All right. So we're looking at the next test, which will be done to babies. Why these babies are still in the abdomen? This is what is known as a chorionic villus sampling. So they call it CVS. All right. You might feel CVS is cardiovascular. No. CVS can also be known as what? Chorionic villus sampling. So it's called, if you hear CVS, before you now start saying the meaning of CVS, you should check around where you are. Of course, if you are in a baby's clinic and you hear CVS, it's mostly this chorionic villus sampling. So you just have to be with what? This placenta of the baby, all right, where it is implanting into the uterus of the mother. I'm trying to now what? Take out liquid there. It could be blood, I'm taking it because I want to do some testing. Of course, I'm doing those testing to dictate if there's any disease condition. You understand? So it's a prenatal diagnostic test. It's used to dictate if there's genetic issues, if there's chromosomal issues in a baby that is coming up. Okay, so it involves collecting a small sample of placental tissue, okay, called chorionic villi. So the whole thing is, it's not even the fluid though. You are taking the tissues, gone. It's not fluid, So you are taking the tissues. So the thing is, you can put the needle through the stomach. You can also put it through the vagina. All right, depends on which side it actually implanted. Do you understand? So for you to know which side it actually implanted, first of all, you must have used ultrasound to visualize it on the screen so that you go accurately. All right. So why is it done? Okay, it's a prenatal test. It shows increased risks of genetic issues. So if the mother is 35 years or older, there's a higher possibility of the mother actually giving birth to a baby that has problems. If you have asked and there's a family history of genetic disorders, right, an abnormal an abnormal ultrasound suggests a possible issue. Parents are known carriers of genetic issues, so you can see that the parents also carry genetic issues. So when is it performed? It's usually done between 10 to 13 weeks of pregnancy. It provides results earlier than amniocentesis. Right, it's typically done after 15 weeks. Okay, so what we got? It can dictate a lot of issues. All right, chromosomal issues like Down syndrome, Trisomy 18, genetic issues like cystic fibrosis, sickle cell anemia, Tay-Sachs, sex-linked issues like Duchenne muscular dystrophy. All these ones are just issues from there. Okay, so it does not dictate neural tube defects like spinal bifida though. Okay, so the procedure, transcervical. So see, it can be through the cervix. This is transcervical. You can put the needle through the stomach, transabdominal. Now look at this baby. Its placenta implanted this side, but the one for transcervical, the placenta implanted at the back. Do you understand? So the type you are using depends on where the placenta implanted. So transcervical through the cervix, transabdominal through the abdomen. So all of them you should use ultrasound. Okay, so there are some few risks, okay, infection, bleeding, miscarriage. The risk is very low because you are using ultrasound to guide you, so you shouldn't injure anything. But it may be complex if the mother has multiple pregnancy. So multiple pregnancy, you have twins. So benefits: you can early on diagnose things. Results are usually visible within 7 to 10 days. Can determine the fetal sex if needed for sex-linked conditions.